Yeah, so the rule is 2 minutes and they tranquilize me, so that's my hard stop. My name's Rob McCready. I'm a Health IT Program Manager in the CMS Alliance to Modernize Healthcare, supporting health and human services. MITRE is supporting this domain, the Health IT domain. It's really dealing with this, the transmission, storage, and processing of your health data, or your family's health data. It's really important for the country. You're in the middle of this amazing transition for the United States, where as little as 10 years ago, less than 20% of the healthcare providers in the U.S. were actually using electronic systems. The rest were using paper-based systems, big file cabinets behind the offices. We're getting rid of that. You know, we're at 80% of U.S. healthcare providers today are using electronic health record systems. And the reason we're trying to do that is to address 3 goals for the U.S. healthcare system: to improve the access to care, to improve the quality of care, and to get better prices on care. And what MITRE's trying to do is to ensure that the data that I've referenced, that it's using data standards that are interoperable and computable so that different services can actually come to the same conclusion when you're processing a patient's health record data. We're also looking at new business models with respect to how do you compensate healthcare providers to incentivize innovation and to improve efficiencies in the healthcare system. So, you know, the best example that I'd give for success for MITRE and for our sponsors and for you is to essentially reduce that barrier to introducing innovation in the health IT domain to be 2 guys in a garage, or 2 guys or gals in a garage, but right now you're dealing with dozens or hundreds of engineers that have to operate in that space. So that's really where we want all of you to be more successful, introduce that innovation that's going to lead to better efficiencies and better outcomes in the U.S. healthcare system. So I didn't get tranquilized. I think I'm still good to go.
Hi, my name's Bob Martin. I'm in the Cybersecurity Center here at MITRE, and we're trying to make sure that you can do that in a safe way, a secure way, a resilient way, reliable way, and one that upholds your privacy expectations. So it's both healthcare, it's air traffic management, energy management, traditional IT. So what we've been trying to do is come up with solutions that can scale, that can happen out in industry. And so our technology transfer is to get these into products, into standards that products can uphold. And if that's of any interest to you, come up and talk to me.
Hi, I'm Debbie Davis with MITRE's Technology Transfer Office, where we protect and manage the intellectual property created by the MITRE technical staff. So once protected, whether by patenting or by copyright, we then work to put the technologies into the hands of the private sector for commercial use. So if you're shopping for technologies, please let me know. I'd be happy to talk to you. Thank you.
My name's Dan Hoag. I'm the Associate General Counsel and Chief Privacy Official here from MITRE. Okay. Okay. So basically, any of the legal work that revolves around all the technology programs that we do and all the project program work that we do, the legal office supports. So that's pretty much it. Most of the time, they don't want the attorney to talk.
And I'm batting cleanup, folks. Name's Steve Foote. I run MITRE's Software Engineering Tech Center, about 350 to 400 folks in 18 some odd locations. You heard Pete Sherlock mention earlier, MITRE's got 7 FFRDCs, and we really cover pretty much the waterfront with regard to the federal government and a wide spectrum of technologies. So it's a playground for software engineers. I would like to shift gears, given that I'm the last MITRE expert, and offer 2 pieces of advice for the entrepreneurs in this space. One, go dig up a copy of Corporate Life Cycles, published 1990 by Adizes, A-D-I-Z-E-S. It's an excellent book that talks about the life cycle of a corporation from its inception through its peak into its aging years. You will find yourself in that book, I guarantee you. It's not in print anymore, so you're going to have to find a tough time basically pulling up one of the used ones. Second piece of advice, I've done 157 due diligences in small companies. None of the 4 startups, obviously, that I started that I do due diligence on. But over that span of 157, I came to realize that the successful startup companies had 3 centers of influence in them, in their entrepreneurs. One, the technical center of influence. Most of the folks here are probably in that role today. You came up with the concept, you're evangelizing the concept, you understand your domain. 2, the social center of influence, and this is often overlooked. Frequently it's the head of sales, sometimes it's the person running the office. 3, the political center of influence, which is usually the person with the business background, sometimes the finance person, sometimes the attorney, Dan, that carries the growth of the corporation. Companies that don't have those three centers of influence balanced well are usually social politically unbalanced, and they come apart as they try and grow the company. The founder wants to own those three centers of influence because it's their company. And what the corporate life cycle talks about is the founder's trap, because you're trying to manage everything and hire people that are just like you. And that's not a good idea. You need people with additional skills to your skill sets. So think about that as you evolve your company. You may be the political, you may be the technical, or you may be the social. But if you can balance those through multiple people, you've got a much better opportunity to grow and expand your organization. So with that, I'll get off stage.